Okay, this video is called Why Diet is the Best Treatment for Arthritis. And the first thing right here is a newsletter by Dr. John McDougall called Diet is the Only Hope for Arthritis. And it's very good. And he had noted that all these foundations are bogus. Whatever the disease, the foundation for multiple sclerosis, rheumatoid arthritis, and all these other diseases, they're always bogus because just use your brain. Think about it. If the foundation cured the disease, they would go out of business. So they never want to cure the disease. So they'll say things like, oh, diet doesn't help in the treatment of, rheumatoid arthritis, multiple sclerosis, or other autoimmune disease. Completely untrue. All right, now we're going to get into some more detail on arthritis. Non-steroidal anti-inflammatory drugs, they can decrease pain, but they can also have a lot of side effects. They increase the likelihood of leaky gut, which causes joint inflammation, causes amyloid clotting, causes potentially joint ischemia. They're mitochondrial inhibitors, not good. Same thing with aspirin. Joint replacement has significant side effects. Most patients do reasonably well with a joint replacement, that is true. But there's a risk of getting an infection in the hip or the knee. I've seen fatal pulmonary emboli with hip and knee joint replacements. I've seen people get a big abscess in the iliopsoas muscles. I've seen people go into septic shock. I know some famous doctors who had knee replacements went into septic shock. They survived, but it was bad. DVTs, deep vein thromboses in the legs, relatively common problem. Now, don't get me wrong, I do know plenty of people too who had unilateral, even bilateral knee joint replacements, and they did pretty well. I can tell you a friend of mine, his mother had a knee replacement and she died from the surgery. I have another friend whose wife had a knee replacement and she died from the surgery. So it's a big deal. A lot of the hip replacement patients are very sick to begin with. Old people fall and break their hip. About a third of them are dead within a year. Pulmonary embolism just means that the clot from the DVT, leg clot in the vein, moves up to the lung and blocks the arteries in the chest, pulmonary arteries, and that can be fatal. And the person needs to be prolonged anticoagulation after that for treatment. Sometimes the metal in the artificial joints can break down and get into the blood and cause allergic reactions and other damage. That's an autoimmune reaction to metal particles. Okay, you can inject medications into the joint like steroids, and those can be great for reducing the pain, but there are potential side effects. Potentially that can increase the chance of injury to the joint. And there are short-term solutions. They might reduce pain for a while, but eventually the pain will, a lot of times come back. So what is like a marathon long-term solution? The low-fat, low-sodium, whole food, vegan diet, 100% organic, single ingredient only. I like single ingredient only because if they put more than one ingredient, they can add stuff to the second ingredient without telling you, like MSG, for example. I like organic because some of the stuff in non-organic food, like the atrazine, the GP, it can be bad for ligaments or it can be estrogenic. Okay. Whole food, because that way you get all the magnesium and potassium vasodilators that increase blood flow to the joint. Joints need good blood flow. Lack of blood flow is hypoxia. You can also call it ischemia, and that often damages the joints. You want no oil. Oil is bad for blood flow. No sweets, bad for your teeth and causes other problems. No caffeine. Caffeine's like psychological stress. It vasoconstricts the blood supply to the joints unless you're moving them right at that moment. Okay, other good things about the low-fat vegan diet, it makes everybody skinny. So it optimizes body weight, so you put less weight on the joints. Dr. McDougall has said the main cause of arthritis is food poisoning with the Western diet. Okay, the whole food plant-based diet also prevents leaky gut, so that's going to reduce inflammation because the bacterial endotoxins and the bacteria themselves then can't get into the blood. And this reduces the risk of OA, osteoarthritis, also called DJD, degenerative joint disease, RA, rheumatoid arthritis, SLE, systemic lupus erythematosus, and gout. Okay, low-fat plant-based diet lowers serum uric acid, so it lowers the risk of gout. And the low-fat diet, it improves blood both in the short term because you're going to have less fat in the blood, less chylomicrons, less LDL cholesterol, less triglycerides. So you get increased oxygen delivery to the tissues because of that. When you have the fat in the blood, it sticks the red blood cells together and drops oxygen delivery to the tissues, in the ballpark of 15 to 20%, which can add up, especially in an old person with hypertension, diabetes, and atherosclerosis. And also by reducing the long-term risk of hypertension, diabetes, and atherosclerosis, the low-fat vegan diet will improve blood flow long-term for the rest of the person's life. Okay, and quite often diabetic neuropathy will improve or even resolve when somebody goes low-fat vegan. You want to prevent leaky gut, which can be caused again by a high-fat diet. It can be caused by a super high-protein diet. It can be caused by toxins in the food that are present on non-organic foods, by alcohol, by unfiltered tap water with fluoride and aluminum. Because the leaky gut will increase clotting in the blood, the amyloid microclots, and that can decrease blood flow to the joint. In addition, it can cause inflammation of the joint. High-fat diets can also cause inflammation of the joints because they cause the neutrophils to release more MPO. MPO is myeloperoxidase, okay, and that is very cationic, meaning very positively charged, and that will cause a collapse in the glycocalyx, okay, because the glycocalyx has a zeta potential, meaning that it's very negatively charged, all right, and that increases the risk of joint injury. Okay. Iron overload also increases the risk of arthritis. It can cause ferrous redox cycling when you have excessive amounts of iron, because then you get free iron in the blood, and that also causes amyloid clotting and can cause joint ischemia. Douglas Kell from England, PhD, and Etheresia Pretorius, PhD from South Africa, are the ones who have written the most about iron overload. They wrote a fantastic paper called Iron Behaving Badly that talks about this concept, and they've done other papers as well. Things that are harmful to ligaments, well, that includes fluoride. Fluoride is toxic. It can replace hydrogens and collagen, the triple helix molecule of connective tissue. Lack of blood flow in general is bad for collagen. Smoking tobacco is bad for collagen. Alcohol is bad for collagen. A lack of vitamin C, and then other toxins in non-organic food are bad for collagen. All these things that weaken or damage ligaments put the joint at increased risk for injury. Okay, so it just goes to show it's pretty straightforward, you know. And Nathan Pritikin patterned his diet after the Tarahumara because he saw that they could run 100 miles in 2 days. Okay, they're incredibly healthy. Here's effects of long-term exercise and a high-fat diet on synovial fluid in mice. Okay, it caused moderate osteoarthritis. Because people, when you call osteoarthritis DJD, degenerative joint disease, people think it's just due to aging or to trauma, but it's a lot more than that. It's due to diet, tissue ischemia, okay, and joint inflammation. Okay, so the high-fat diet is bad for health. This is well known. Okay, here's a paper, clinical and radiologically study of serum fluoride in relation to knee arthritis. There's increased risk of knee arthritis in people with elevated blood fluoride levels, okay? And they tend to have more severe symptoms and more radiographic findings. Okay, there's such a thing as called endemic fluorosis, where it's endemically high in concentration in the local waters, like in India in some places, and they have a lot more fluorosis of the spine and the joints. Okay, it's not good. Okay, here's a paper, decreased sulfate content in zeta potential distinguish glycosaminoglycans of the extracellular matrix, osteoarthritis, cartilage. So there are some things that can deplete sulfate, and some of the things that are thought to do that include the chemicals in non-organic food like GP. There's some people who have written several papers about that, and that's thought to be harmful to the glycocalyx, both of your endothelial cells, and also you've got glycosaminoglycans, sort of these sugar molecules as part of your cartilage in your joints, and that also can be damaged by a lack of sulfate due to the toxins that is thought from non-organic food. So the bottom line is a person should go for it with the diet. I've seen people that, they tried everything for their arthritis, they can't improve, and then they go on a low-fat vegan diet, organic only, whole foods, low sodium also, avoiding oils and sweets, and smoking tobacco, alcohol, etc., and caffeine, and they get a lot better. Okay. So anyways, I hope you found that helpful.